May is Hysterectomy Awareness Month, and more than 500,000 women, that is, undergo the surgery each year. But a recent poll finds only half actually know what happens to them during the procedure. So joining us this morning is Dr. Paul MacKoul, founder of the Center for Innovation Gynecological Care. Dr. MacKoul, thanks for being with us this morning. Pretty startling statistic. Why is it that these women don't seem to know what's going on?
A lot of it is information. Patients just don't get all the information they need, and some people don't understand what actually the uterus is versus the ovaries, for example. What I'd like to do is maybe draw a slight picture diagram for you, and if the camera can get that in. So this essentially would be a uterus, and the vagina would be here. And I'm going to draw this in such a way that you can actually see the ovaries and the tubes going to the outside. Ovaries and tubes. And the rest of the picture, here's the bladder. I'm going to label that as a B. Here's the rectum down below. So you can see bladder here and the rectum here. And then the rest of the story. So here's the belly button and the spine back this way and the buttocks in the back. So a hysterectomy refers to removal just of the uterus. You're not taking out ovaries. And the ovaries make all the estrogen, the progesterone, and the testosterone. So your ovaries actually here keep you healthy, keep your hormones stable. If you take out just the uterus, you're not affecting hormones, and therefore you're not going into menopause. So hysterectomy is just removal of the uterus only.
And so are women just not asking the right questions before they head into surgery? Do they not know what to ask?
A lot of the times they're not sure what's going on, why they have symptoms and problems. I'm going to draw another sketch.
Okay.
I'll show you a very common condition, which is fibroids, and go over how fibroids can cause these problems. So this is a much bigger uterus with all these fibroids in it. And you're going to see how fibroids can cause many different issues. Again, I'm putting the bladder and the rectum in, and here's these big fibroid tumors.
Inside the uterus?
Inside the uterus.
Okay.
Most of the time they are. And you can see this fibroid tumor actually is involving the lining of the uterus here. We're going to put the ovaries in too, and the tubes. Sometimes these tubes get lost because of all these fibroids in place. And pubic bone again, and belly button. And you can see the spine, buttocks, and back. So what happens in this situation, the bladder is actually being squashed by these fibroids. The spine is back here. The uterus has no place to go, so it pushes into the bladder. It can also push into the back and cause back pain. So a lot of people have back pain, pressure, bleeding, don't know why. Diagrams like this help them understand what's going on and what needs to be done.
And so, just real quickly, what would your suggestion be for women who are about to have this procedure? What kind of questions do they need to be asking?
Really, a lot of it has to do with getting information either from your primary care physician, your WJLA, or online, and actually managing your own care. This is a very important point. If you manage your own care, then you know exactly what has to happen. An example here. Let's say you go to your OBGYN and he wants to do an open surgery. That's a big cut like that. This is 6 to 8 weeks recovery time, which is really quite debilitating. But there's other options. We do something called dual port, which is 2 little tiny cuts.
Is this laparoscopic?
Laparoscopic.
Okay.
So laparoscopic is always what you should do, not open surgery.
Okay.
With those 2 little small cuts, you can actually take the uterus out here and here. And that patient goes home, same day, goes back to work in 7 days. Now, the open surgery doesn't allow that. And then in between, there's variations. Robotic surgery, everyone's hearing about robots. Robots actually have cuts that are in the upper abdomen. So the recovery is going to be less with smaller cuts, longer with larger cuts.
Okay.
So if they ask the right questions, get the information, they can manage their care properly.
All right. Good advice since this is Hysterectomy Awareness Month. Dr. Paul MacKoul, thanks so much for coming in. Really great information for women.
My pleasure. Thank you.